Recording. Hello everyone and welcome to this interview preparation session. I made this little video so we can so I can talk about common questions, tips for interview, and better prepare for the upcoming interview that you guys are booked for. So let's start then. Well, my first tip is to read the interview preparation guide. I mean, it's on the resources folder I've sent you all. So my advice is to read it carefully. I know it looks long, but it's worth it. It contains important tips, and there are a lot of example questions that the panel might ask. So read it, prepare answers to the example questions. I would start by that because it explains the main layout of an NHS interview and what are the, some bullet points that constitute the most important things to be done well in the interview. So my advice is to read the guide. It's on the pre-interview preparation folder. So it should be easy to find. If you don't find it, please drop me a message and I will indicate you where to go. So yeah, prepare answers to the example questions. Talking a little bit about the interviews and how interviews are done in the UK. So in the UK, we have what we called value-based interviews. All interviews in the UK are value-based. What does this mean? So it means in the NHS, every hospital, every trust will have some values. Normally, if you go to their website and you go to the section about us, they will have a vision and values section, and you can see them over there. Now, sometimes when we do interviews, we interview for more than one hospital, so they might not ask for the specific hospital values. If you are interviewing for just one hospital, then it's worth it. It's worth going onto their website and review those values. And all the questions in these value-based interviews are scoreable. So these are approximately the parameters they use to score questions. So 0 would be failed to meet, 1 point partially meets requirements because it's a point-based interview. There will be a minimum score that you need to reach. Some trusts ask 15, some others 20. It depends on the requirements of the trust, and you will earn points for each question. So 0 would be fails to meet, 1 partially meets requirements, 2 meets requirements but borderline, 3 meets requirements fully, and 4 exceptional. So if they ask you about, for example, imagine that one of the hospital values is patient safety. They don't want you to give the dictionary definition of patient safety. They want to know how do you execute, how do you apply patient safety in your daily practice. So think about examples for that. An exceptional score would be to give 2 examples, 2 detailed examples about that. Meets requirements fully would be that you give 1 good example. Avoid being vague. Short answers do not demonstrate and cannot talk a lot about your experience. So try to be detailed in your answers and in your examples, because they do want to know how good of a nurse you are. So yeah, think about the details, think about your practice, and choose the values and then prepare examples for them. If you don't give examples or the answers are too short, or there are not many details on your examples, then maybe you can get 2 points, meets requirement, borderline, or partially. So it's really, really important. This is not a mere question, a not important question that they ask. And the most important thing is that all questions are scoreable, including the one that they ask you, talked a little bit about yourself. This is the moment to sell yourself, to talk about your experience. So even that question is scored. Or why do you want to come work for this hospital? All questions of the interview are to be scored. So don't think that they are just, they are asking you these questions as well to break the ice and to give you a chance to talk about you, but they will score it, because if you're not able to talk about your own experience, could mean that there are some things that you don't have clear in your head. So but all of us, I'm a nurse as well, and all of us are able to talk about that at length. So it should not be a problem. So one easy question, talk about you. Why do you want to come work in a hospital? That can get you some easy points. Now, 6 Cs of nursing. So most of the times they want to ask about hospital values, but they ask about 6 Cs of nursing. The reason for this is that the NHS unified criteria, and they decided to choose some values that have to be common to all of the NHS, that all of the NHS trusts have to comply with these values, and all their staff should show this kind of values in their practice. They're called the 6 Cs because all of them start with a Z, obviously. And those are care, compassion, competence, communication, courage, and commitment. Now, again, they are not asking you to give the definition of compassion, the definition of commitment. Probably the question would be, have you heard about the 6 Cs of nursing? To which you must answer yes, because you have read about this. And the second question would be, can you give us an example of how you apply one of these values to your daily practice? It might be that they tell you, give us an example about compassion. If they tell you to give an example about any of them, you can choose the one that you're more familiar with, or that you have more expertise or have prepared more examples about this. But it's 90% of the times they will ask about 6 Cs of nursing. So again, one question that will surely come up in 90% of the cases. So easy one to prepare. Then strengths and weaknesses. Prepare some answers for this. Desirable strengths can be found on the interview guide. Like teamwork. Again, this is examples. Prepare answers. What are your strengths and weaknesses? You could say, I'm a good team player. I recently had a cardiac arrest and it was my patient, and I lead my team, or we worked in a team really well, and blah blah blah, give details about how it went, and it went fantastically. This is just an example. Of course, if this is not your case, just prepare an example with your practice. About weaknesses, you could say that you have issues. Try to be not a thing. For example, don't say that my issue is that I'm not a very good listener, because that is a essential quality. So try about weaknesses, try them not to be essential criteria. You could say, for example, that you have issues with time management, or with that you spend a lot of time writing your patient's notes, for example, but that you're working on it and you're getting better and better. Things like that you can adjust and you can improve on, and always add at the end that you're working on improving that. The NMC Code of Practice as well, be familiar with it. What is it for? They might ask you, do you know the NMC Code of Practice? Are you familiar with it? If they ask you, you have to say, of course, it's the Nursing and Midwifery Council, and it contains the professional standards that registered nurses, midwives, and nursing associates must uphold. So it's the ethical code. And it has 4 main points: prioritize people, practice effectively, preserve safety, and promote professionalism and trust. So again, a good chance to, some examples might be the same to the 6 Cs, so you can use them for both things. Yeah. So, but please be aware of these 4 main points, because they might ask about it, and they might ask how you promote professionalism and trust in your hospital, for example, or how do you prioritize people. In that case, you would be prepared. Administrations of medicines, very common questions as well. There is a guide, RCN administration, the Royal College of Nursing's administration of medicines guidance on the interview prep folder, and questions about medication administrations are very, very common. Questions that might come up, administration of controlled drugs, which is on that guide, and how it's done in the UK. But also a very common question is that you have a colleague, or maybe yourself, you have done a mistake on the medication administration. What should you do? So if it's you that made the mistake, of course, NHS is always patient-centered. So you will notify your patients. You will let your patients know, because in the NMC Code of Practice as well, if you read it, we have a duty of candor towards our patients, and we have to be honest and transparent. And if the NHS is patient-centered, of course, the patients should be the first ones to know. This would be a good moment to ask about potential allergies if you have given this patient a different medication than the one that should have been given. You can ask about potential allergies. Of course, you would monitor the patient. You will notify your coordinator or your nurse in charge, and the doctor as well. And after that, you would file an incident report, of course, what in the UK is called a DATIX. Another common question is that a colleague of you makes a mistake, tells you about it, but she tells you, please don't say anything. I would like this to be kept between us. What should you do in this case? But this might be one of the questions. Of course, you should remind your colleague about the correct procedure. And you should remind them about the duty of candor that the NMC Code of Practice states that is mandatory for all of us and that we should have. If your colleague insists that, no, please, I really don't want this to be shared with anybody, I do not want to do any of this, you should then inform your senior. And of course, follow the same procedure, notify your senior, etc., incident report, blah, 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 blah. Again, very common questions that can arise. Regarding medication administration, if at certain point they ask questions and you don't know the answer because it's not in the RCIN and administration of guidance, which normally it is, but I don't know, they could ask about anything really. So if they ask about anything and you don't know the procedure for it in the UK, you can always say that you would refer to the local guidelines or that you would ask a senior about it. Clinical scenarios. I cannot stress how important this is. So the clinical scenarios are not particularly difficult, but they do expect that you know how to work in a team. So questions about the scenarios can be varied, but the common denominator to all of them is that you should always escalate. You should always escalate the problem. You should ask for help if you're worried about a patient. If you see a patient that is deteriorating, and please be familiarized as well the NEWS score. So in the UK, we have a score called NEWS. So it means that when we take the vital signs, if the vital signs are out of range, for example, let's say if the blood pressure is really high, it will give us 3 points on the NEWS score. The higher the NEWS score is, the more likely the patient is to deteriorate. So imagine you take your vital signs, the patient has a really high NEWS score, always escalate to a senior and always escalate to a doctor. Escalate is really keyword here, so please mention it if you are asked about the clinical scenarios, Your patient is deteriorating. You see that the patient is quite unwell. What should you do? The first thing before doing your ABCDE assessment is call for help. So call for help and then ABCDE assessment, airway, breathing, blah, blah, blah. But the first thing to do is to call for help, because while the help comes, you can start doing the assessment, but at least the help will be on their way. So yeah, always ask for help. The most commonly used tool in the UK to communicate information about a deteriorating patient is the SBAR tool. So you can look this up on the internet, but I included an image here because it's important that when we escalate about patients, you can mention in the question, and I would use this SBAR tool to tell the doctor what is happening with what's happening with my patient. So you can see here is SBAR stands for situation, background, assessment, and recommendation. There are a lot of videos in YouTube that you can check out with practical examples. SBAR call. If you write that on YouTube, NHS SBAR, you will see training videos on how they do it. But the situation would be, for example, I am Sandra. I am a nurse on the ward. Vascular surgery ward. I am calling about Mr. Jones, and I am calling because I'm concerned that he might be having sepsis, or because the blood pressure is low or high, or his temperature has gone up in the last few hours, or the warning score, the NEWS, is very high. The patient was admitted on this date with, the diagnosis, because sometimes doctors or seniors might be covering more than one word, so they need to be reminded so they can quickly find this patient's information. With, for example, chest infection, they have had this investigation so far, and tonight it has changed, and now the temperature is this, and the blood pressure is low. Their last set of observations were A, B, C, and D. And the patient's normal condition is alert, and now he's confused, for example. The assessment, I think the problem is that the patient has sepsis, for example, and I have given oxygen, and I have given oxygen, I have taken another set of vital sets, or you could say, I am not sure what the problem is, but the patient is deteriorating, or I am worried. And then the recommendation. Oops, sorry. And then the recommendation, I need you to come see the patient in the next 10 minutes, and is there anything you want me to do in the meantime? Do you want me to start IV fluids, or do you want me to repeat the observations, etc.? So it's a very really structured way to tell somebody else about what's happening with one of our patients. So common scenarios or common questions about clinical. Pressure ulcers, they might ask you if you know about pressure ulcers and the interventions or the measures that you would take to prevent pressure ulcers in patients. So I always send a guide on the email so you can look about this. So be specific about that. To be specific, by being specific, I mean, don't say, oh, I would change the patient's posture. I would do postural changes. Okay, they want to know how often would you do postural changes? How will the head of the bed be tilted? How much? I would put the bars up. You know, be specific about this. I will put the I will put the I will do postural changes every 2 to 3 hours if the patient is not quite mobile. And of course, I would do a Waterloo score for pressure ulcers, or I would use some kind of score, and depending on the risk of the patient, the postural changes would be more or less, etc. False. Again, refer to the guide sent on the email. In this case, be specific as well. We would put a sign saying that this patient is at high risk of falls. We will inform the patient to have the bell at hand and call us if they want to move. I will put the bars up. I will, if the patient is a patient that has dementia, for example, I will inform the family that while they're with them, if the patient looks like it's going to get up, please call us. And of course, put the bed on the lowest possible setting and things like that. High temperature and diarrhea, it has come up quite often. So the first thing we need to do if we have a patient that is coming with high temperature and diarrhea is isolate them. So we have to put them in a side room because it could be C. diff, and that can quickly spread to other patients. So high temperature and diarrhea, we tend to always isolate in a room, and of course hydrate the patient, etc., etc. Sepsis. Sepsis is the most important of these clinical scenarios. Sepsis comes up also in 90% of the interviews. So know your sepsis 6 and know how to recognize it. There is this link from GKMedics. GKMedics is a website for doctors, but have excellent information and very simplified. This for doctor students. So I recommend you checking the link so you can see how to recognize sepsis and what are the red flags. And of course, know your sepsis 6. I've included the image over here, but I always like to remember, like, give 3 and take 3. Give oxygen, give IV antibiotics, and give fluids, and take blood cultures, take a gas sample to measure the lactate, and take the urine output hourly, so we know how the patient is doing. So yeah, very, very common. Please study your sepsis 6. Another easy one that you can score points with. Now, questions about teamwork and escalation and communication. Communication is a really important and valuable skill in the NHS. So they can ask a lot about communication. For example, questions that have arisen before in interviews. You are unable to reach a doctor. What would you do? In this case, you would call the cardiac arrest team or the fast response team. In every area in the NHS, you will have a number. Normally, it's a really simple number, that 4444, 2222, things like that. So you won't know what's the number for the fast response team or the cardiac arrest team in the hospital you're interviewing for. It might be different, but you would say, I will check what's the number for the fast response team or a cardiac arrest team, and I will call them. If you are unable to reach your doctor and your patient is deteriorating, you need to call the fast response team. So yeah, you would check what the number is, you will call them, because it's a team that is always on call, and when we go through switchboard and we call them, they always answer. and they will always be available. So if we can't reach our doctor, because our ward doctor at night times, it might be that he's busy with somebody else, and it might be that in that moment he can't pick up the phone, or the phone is malfunctioning. So these teams are there for that, for a patient that's deteriorating and we need a doctor, we need a team to come see them. Other things, you see a doctor that doesn't wash his hands, what would you do? Of course, in the NHS, it's all about communication. It's all about being smart on how to communicate things, of being assertive. So you would remind the doctor about our hand washing policies, and that to prevent infection and according to the rules of infection control, we need to wash the hands between patients. So simple. It would demonstrate that you know the policy, and even if it's a doctor, we can talk with them. UK is a really multidisciplinary team environment, so it won't be a problem if you remind somebody else of the policies, because we are all humans and we can make mistakes, and we are there to help each other. So it would be a good thing that you remind this doctor that he didn't wash his hands, and you help another patient by preventing possible infections to spread. If the doctor says, "Oh no, I'm not going to wash his hands. I don't need to do that," because it's possible that the panel asks you, "Okay, this doctor does not want to wash his hands. What should you do?" You should escalate to your nurse coordinator as well and tell them what happened, and they could speak then with that doctor's superior, because that is not an acceptable behavior. Another question: patient complained about your care. What would you do to correct the situation? If a patient complained about your care, we should always try to be empathetic, because we don't know, our patients are vulnerable and they're in the most difficult situation in their lives. They're really vulnerable at this moment. So it might be that they're worried about something and we weren't able to see it. So we would try to be empathetic. This is where we need to practice our active listening. And just ask them what is wrong and what we can do to help it, and say, "I'm sorry that you're not happy with my care. Please tell me, how could I improve? Is there something else I can do? I'm sorry if I didn't notice this or that, but I'm here for you and I'm listening now," etc. So what would you do to correct the situation? The answer is always active listening. Of course, apologize to the patient and see what you can do to help them. And lastly, and very importantly, ask questions to the panel. At the end of the interview, they normally ask you if you have any questions for them. Now, a lot of candidates think that they should answer no to this question, because they will say, "Oh, do you have any questions for the panel?" The candidate will say no, and the panel will think, "Oh, this candidate has everything very clear in their head. So good stuff." No. They are expecting you to ask questions, because asking questions will demonstrate that you have researched the hospital, will demonstrate that you are enthusiastic about the role, that you really want to work for the NHS. So investigate the trust, investigate the hospital, look at their website. Is there an area that interests you? Maybe you go to the website of a hospital and they have a really good cancer center. You can ask, "Oh, I saw on your website that you have a cancer center. What are the opportunities to work in there? Because I'm really interested in that." Or research projects. "I'm really interested in nursing research. Are there research projects ongoing on your hospital? Because that's something I would be really interested in." Or things like that. Does your trust have an education center? Are career pathways set for us nurses? And lastly, you can ask as well, how do they support international nurses? Because moving abroad sometimes can be really scary. When I did it, I felt scared at times, and it's good to admit our own fears and insecurities. So it will show you're human, and it will show that you're also brave to take this step, but you can also feel fear. So show you're human, and you can tell the panel, "Well, moving abroad sometimes scares me. So I would like to know, do you have teams that support international nurses and the issues we might experience?" So that's a good question as well. But please don't limit yourself to these questions over here, because you can think of your own. And it's always good to think your own questions. What are you interested in? And as I said, investigate the trust. And this is all in a nutshell. Those are the general tips for nursing interviews. If you have any doubts, please reach out to me on WhatsApp. I'm always happy to hear your examples and see if they're adequate or not, and help in any way I can. So please do, and good luck with your upcoming interview. Bye bye.